Hello and welcome back to our next episode of Conceive. This is our third episode with regard to PCOS. Our expert, Dr. Anita, has been doing the past two episodes explaining what PCOS is, what are the symptoms it exhibits, and how to manage it, both medically and non-medically. And in our last episode, she gave us plentiful tips on how to manage it with diet and even the practical aspects of how to do it. And in this episode, we are going to see what we need to do with ourselves with regard to our lifestyle. Thank you, Dr. Anita, for all the informative, interactive sessions that we had earlier for the PCOS with regard to the diet. We are all looking forward to your information that you would need to provide with regard to the exercises that we need to do to prevent PCOS.
PCOS, as I have been explaining in the last couple of episodes, it's become very, very common nowadays. Maybe 20 to 40% might be affected. Many women who are affected are suffering because of all the symptoms. People have difficulty in getting pregnant, weight gain, acne, irregular periods, all are problems related to PCOS. So, we have been looking into the various aspects of treatment like lifestyle modification, diet. In this episode, I would like to give more details about the sort of exercises needed, the amount of physical activities which are needed to either to prevent PCOS or to try and control the symptoms of PCOS. And also I would like to give a few tips regarding lifestyle modification which might be helpful for PCOS. There are various different elements when it comes to the lifestyle changes in PCOS. Surprisingly, sleep is one amongst them. Proper sleep, timing, and how you do it, when you do it, just as in diet. The amount and the duration of physical activity that is needed, the changes in the lifestyle as to the amount of stress and strain one incurs, and as I explained, lots of things to do in the diet. These are all things which you could change, practically changed to avoid a doctor. So, it's like, an apple a day keeps a doctor away. So, I am going to give you tips how to avoid seeing me or consult me or come for treatment for infertility.
I thought we were going to talk about exercise, and I'm surprised that you mentioned one of the elements as sleep. Is sleep such an important or a major factor for PCOS?
Sleep or anything related to sleep doesn't cause PCOS as such, but if you look at PCOS as a condition and you want to try and reduce the symptoms or to prevent PCOS, sleep does have a role. Because see, the incidence of PCOS is actually going up, in the last couple of years. And one of the contributing factors is the abnormal sleep pattern. Mm-hmm. What happens is that humans are engineered to sleep actually before it, by the time it gets dark and before midnight, and wake up with the rising sun. But what happened nowadays is that there are a lot of people working on the night shifts, or a lot of people work late. So, the sleep rhythm is altered. So what actually happens is that the exposure of the artificial lights are much higher if you tend to work late or to sleep late or even do night shifts. So, that means when you are exposed to too much light at night, that alters the various different enzymes and chemicals in your body, and it has shown that it can actually cause PCOS like symptoms, especially in birds. Near the cities where there are too much of street lights, and in a city like Las Vegas and all, those kind of artificial light has actually shown that the breeding of the birds are very badly affected.
Okay.
So the same phenomenon happens to a small degree to the human population as well. So, you know, getting exposed to artificial light is not good for women, especially working over the nights are not good for the women in regards to their abnormal hormone levels and PCOS. That is just one aspect.
Okay. So you mean to say even if somebody sleeps during the daytime,
it is not sufficient.
it is not sufficient.
Not sufficient. So you have to sleep early and wake up early.
And sleep in the night itself.
Yeah, sleep in the night itself.
Okay.
So you should not get basically exposed to too much of artificial lights, plus the lights from the TV and the computers and all that. In addition to the night lights.
So these things do affect.
Yeah, do affect. And another aspect of this sleeping problem at night or night shifts are that the certain components which produce hunger are actually related to a substance called ghrelin, which is released from the brain, and that if you actually work on night shifts and don't sleep at night and sleep during the daytime, your hunger levels are higher. So there is always a chance for higher intake of food, and obviously it leads to overweight and obesity,
as you mentioned in the previous
and
episodes.
the sequelae. Yeah. So if you work at nights, take care.
Okay.
You might put on weight.
So this is something like what I've heard earlier with regard to the body clock, is it?
Yeah, yeah. It's very much to do with the body clock. You know, we all have a body clock, and we have to listen to the body clock.
Okay.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. Southend Fertility and IVF.
This program is brought to you by Southend Fertility and IVF.
So now you did explain with regard to the rest that we need to take. What about the exercise that we need to do? The amount of exercise and the type of exercise that we need to do to prevent PCOS?
When it comes to exercise, again, I think I can ask you to do exercises like aerobics, gym, swimming, yoga. Everything is available. But what I personally feel is that people keep saying that okay, you have to work out, you have to do exercise. What I feel is that you have to look into it in a practical way. There are some exercises which might be relevant to one person, may not be possible for another person.
True.
See, if you are a full-time working person, you may not even have time to dedicate yourself for exercise. Again, you have to rearrange your life in a way that you should be able to inculcate some form of physical activity on a regular basis, because all the studies have shown that even half an hour exercise per day is sufficient to keep PCOS at bay. But saying that, all these studies prove all these things, but what I have seen practically, I've worked in city, and what I find is that women who do exercise for half an hour and who work for 8, 10, 12 hours a day sitting without making any movement, they don't tend to get better. So there is something more to just exercise. What I feel is that in addition to whatever exercise you are able to do or whatever classes you are planning to join, what you need to understand is that your basal metabolic rate or physical activity needs to be constant throughout the day.
A balance is required.
A balance is required. There is no point in doing hectic exercise for half an hour, sweating it out, and then sitting the
throughout,
whole day.
yes.
There is no point in that. So what you need to do is keep moving. I know it is difficult. If you work in an IT, you know, how is it possible to keep moving? You'll be sitting in front of the computer the whole day. So it's not easy, but you have to try and, you know, do something to
Find
at
a way
least,
to overcome it.
yeah, overcome that. You know, I remember that when I was flying sometime back in one particular flight, they were actually showing exercises on the screen.
Okay.
So that motivated all the passengers to actually do it. It was quite simple. You can do a lot of things sitting down. You know, you can move your neck.
Yes.
You know, you can do this. You're working in front of the computer. Take a small gap after, you know, 15 minutes, half an hour. Move your legs, hands. Do something. You know, you can move your legs. You know, you can bend. You can do many things.
The sitting
You know,
posture itself.
you can do stretching. So you could move your body a little bit if you're in an office job.
Okay.
Saying this, it is not just sufficient to move yourself like in this way. You do need an intense exercise for at least half an hour. As I said early, try and find something which is comfortable for you, which is convenient for you, which is available for you. See, if you like to dance, join a dance class. You know, there are a lot of benefits. One thing is that, like, you know, you do get your exercise. Other thing is that you're developing a hobby which you might actually enjoy, and, you know, it's healthy for you. It's good for you to have a hobby.
Both for mind and
Yes,
body.
it takes away all your troubles, your job, your family, everything is away, and you just enjoy yourself. See, if you are a water person, go for swimming. Swimming has a lot of advantage because it provides all the exercise that is needed, and it spends extra calories because you are obviously in the water. It spends more calories than when you are actually working out. The other thing is that you can do aqua exercises, which is a new thing. It's quite good. I was in hydrotherapy hospital, a spa in Switzerland recently, and, you know, I attended this aqua exercise session, and I think it's wonderful. You do all the exercises that, you know, all the stretching and bending and all the thing that you do on land under the water. The advantage is that it is not painful, it doesn't injure any of your joints, and if you do it in a group, it's extremely enjoyable. With the music, you do exercises in water. So it's a good way of doing exercise to shed your weight and then, you know, to improve your metabolic rate. And when you think about doing gymming, you know, if you want to join a gym, if you've not been doing a lot of exercise before, it can be quite difficult.
To start off.
Yeah.
Yes, yes.
See, I see patients who say that, okay, I recommend them exercise and they go to gym, they do it after 2-3 days, they stop it, they say that I have back pain, I have leg pain, you know, I had this, that, and they stop. They restart after a couple of months, do it for a week and then stop. So it doesn't seem to be very persistent. So what I normally suggest is that you first get healthy a little bit before you can actually do the gym. Start walking. Start walking for 10-15 minutes a day, if possible brisk walking. That is enough, 15 minutes a day. Then after 2 weeks, you do an increment. So you don't start increasing it day by day.
Yeah.
So you do it only once in 2 weeks. So you have to have a focus. You have to have a set goal, you know, how much I'm going to achieve. You should make a diary of yourself. Okay, this month I'm going to walk half an hour a day. So start with 15 minutes. After 2 weeks, you make it half an hour. Okay, after 1 month, you know, you increase it to 40 minutes if possible. So you should have a set goal, and then, you know, you try and increase your physical activity slowly, and then you can join a gym or aerobics class or Zumba class or whatever. Zumba is extremely fun and active, and many women enjoy Zumba a lot. So it's quite available everywhere, and I think that, you know, women should join some classes to keep themselves active. What else we can do? I think one of the best form of exercises for PCOS is yoga. I have done special episodes on yoga. I don't know whether it will come before or after this, but, you know, you have to watch it. Yoga is fantastic. It has so many actions, you know, not just an exercise, you know, it changes the way you even think. So I think it's very useful if you can. And if you can actually find somebody to teach yoga, you could get some CDs and or download from it and start doing it at home. So anyone can do yoga. So do something. The baseline is start now.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. South End Fertility and IVF.
This program is brought to you by South End Fertility and IVF.
So what are the lifestyle changes would you recommend?
So we have looked into diet, we have looked into physical activity, exercise, sleep pattern. I think if we add more lifestyle, as I'm going to recommend, you may have to go to the Himalayas and start becoming a yogi. But still consider these changes, it will be good for you.
You've given us the tips on a practical
basis.
So
practical
I'm sure
basis. Yeah, okay. One reason for infertility, subfertility, PCOS and all these problems are delay in family building. Nowadays, we have women trying to study more and achieve more in the career. So there is a delay from the 20s to 30s or even the 40s before they plan to get married and settle down or have a baby. In a way, it is good for the empowerment of the women, but at the same time, there is something called the biological clock, as in the body clock, and it is ticking fast. So what happens is the chance of having a baby is coming down with the years going by. So I think in case of fertility, women have to try and a bit early and not delay too much. If you're very particular of building a family,
what age would you recommend?
The best age is in the 20s, but at least before the 30s. Early 30s, you have to try and baby, because the chance of having a baby gets less and less, and there is a higher chance of having abnormal pregnancies, miscarriages, or multiple gynecological problems as age advances. And the PCOS tends to advance, the weight tends to go up.
All complications.
All complications. Most of these gynecological problems starts to come with age. Saying that you have to put your studies and career also in this thing. So that is one aspect. The other thing is that what I do find that couple even after getting married, they tend to get separated for the purpose of either study or for purpose of
career.
Job. So those kind of separations do negatively affect fertility and PCOS. Humans are built in a way that the whole thing is biological. You have to understand that these things are biological. Biological in the sense that the ovulation, fertility and all these things are controlled by hormones released from the brain. So the fertility hormones are controlled, the ovulation, all these hormones are controlled by hormones released from the brain. Okay, so we have something called hypothalamus and pituitary gland in the brain. So what happens is that our daily life, the way we live, the way we think, everything will influence the hormones. So when there is a disparity between the biological living, the natural way of living, and when couple are separated for either job or any other studies, what happens is that they don't have a natural relationship with each other. There is a break in that. So you're trying to put a break on your physical needs. You understand what I mean? So what happens is that if you put a break on your physical needs, the brain will put a brake on your hormones, right? So, if you put a brake on your hormones, you don't ovulate. So, you become PCOS. So, one element is that you don't have regular physical regular interaction with your partner. So, that is also one element that you have to. So, you know, as a joke they say that, you know, there is too much of sex in the media now, but none in the bedroom.
Okay.
So, what we need is that we need to reduce the sex in the media, and we need to go back to the old ways where people used to have regular physical intercourse properly, because of the jobs and separation. And you can't really ask the couple when they come as a patient. Often you tell them that, okay, you need regular intercourse to get pregnant. They say that, doctor, we don't have time. See, I'm tired by the end of the day. I'm working till 10 o'clock, 12 o'clock and traveling another 1 or 2 hours. We don't have time. So, that is a very pathetic situation we have reached. Because if you think of what we are achieving from our career or life, you have to understand that you might be able to buy a big house, you might be able to have a nice car, but what you have to do for that? You have to work 12 hours.
Sacrifice the life.
Sacrifice your life. So, what are you actually achieving by sacrificing those? So, you have to think back and see, like, am I comfortable working in so many particular hours? Am I comfortable doing this job? Am I able to actually spend enough time with my spouse? So, instead of just, leading your life the same way every day and everyone else is doing, you have to think and see whether, is it okay for me to be like this? So, it's not that bad to think like a yogi, you have to start thinking whether all these things are, whether you have time for everything, not just your job or career. You have enough for your personal hobbies, to have a nutritional food, proper diet, enough time with your spouse, or if you have children, you have enough time with your children. So, it's time that we think seriously
and we weigh the options,
change what we do.
To weigh the options and choose what we really need. Is it the career, the money, or the family and health?
Yeah.
This is a very new insight that I've had into disease as such. Because when we think of disease, we don't relate it to our lifestyles and any of these things. That's totally different. You take medication, it goes. That's what we usually think.
But polycystic ovaries are hugely lifestyle disorder. So, if you change your lifestyle, you might actually get completely all right. I remember I had a patient whom I used to treat for PCOS. She was a little bit on the overweight side. I used to give all different medicines, injections I tried. She would not ovulate. You try everything, she will not ovulate. Then, we have a festival called Onam in Kerala, and then I asked her to go for some dance class. She went and joined for some dance class called Tiruvadira. So, this is kind of a local dance that people practice. So, 1 month she was on, a hectic dance class, So, what happened the next month? I see her coming with pregnancy. So, I tried all the medicines, and then, 1 month of dance class was enough for her to start ovulation. So, it's good. I've seen a lot of patients responding to regular exercises. So, if you add medicines with exercise, done. It's done. It's good for you. She has a nice little cute baby now, who is 1 year old.
She should have named her Nritya or something, because it's through
I can't remember her name, but that's a very good idea.
The thing is, just these simple things.
We have to bring back all those things in our life. We should not stop playing when we reach 20s. You have to continue your hobbies, dances, sports, whatever. You have to keep playing. It's good for us, good for the health.
Doctor, like the tips that you gave for our diet, do you have any tips for this? Because we always think that all these things, our career and all those things are important, and we neglect this. But I'm sure you would be able to help us with some tips.
Yeah, definitely. I would say watch TV only half an hour per day. That is the recommendation, not more than half an hour. Watch only Conceive if you have Conceive. And again, same with computer and going on social media. I think people are talking too much. It's a little bit boring talking about the same thing. Avoid too much of social media to reduce your. You'll be sitting all the time when you're on that. So reduce that. And maybe try and do a lot of household works. Rely less on maids and stuff. Do your work. It will keep you on your toes.
Thank you, Dr. Anita, for all the tips and the information that you've provided us with regard to PCOS. In fact, PCOS is something which I thought about as just a disease. But these 3 episodes of interaction which I have had with you has opened my eyes and provided a whole new view, not just only on the disease, PCOS, but even life as such. Life, not only individually, even family life, health, mind, body, all put together. It has totally been an eye-opener. Thank you very much for all the information that you could provide us. Until the next episode of Conceive, goodbye.
This program is brought to you by South and Fertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. South End Fertility and IVF,